Hello, I am Dr. Parthasarathi. I am a consultant dermatologist, cosmetologist and a trichologist. I have my main center in MG Road, that is in the Magrath Road. Also, I have few branches in Indiranagar, Koramangala and Frasertown. See, fungal infections are again a vast subject. There are superficial fungal infections as well as deep fungal infections. But I will be talking here mainly about the superficial fungal infections, the infections which usually we see in our day-to-day practice. The superficial fungal infections is called dermatophytosis caused by dermatophytes. That can be differentiated according to the site of the occurrence. Like if it is on the scalp, we call it tinea capitis. If it is on the face, we call it tinea faciae. If it is on the beard area, we call it tinea barbae. If it is on the body, we call it tinea corporis. If it is on the crural areas like groin areas, we call it tinea cruris. If it is on the feet, we call it tinea pedis. Like this. If nail infections, nail fungal infections, we call it tinea unguium. So like that, fungal infections, these superficial fungal infections are very common nowadays. There are various reasons. One is obviously the modern tight clothes, tight jeans and dresses, and it also differs from place to place. In hot humid areas it will be more. The areas, the folds of the body, it will be more. Since the areas sweats more, the fungus usually grows on the wet areas. As I told, depending on the different sites, we call it like tinea corporis or cruris. Coming to the investigations, usually with clinical features itself we can make out, but sometimes we do KOH mount where we can see the fungal hyphae under microscope. We can also do skin biopsies, which is rarely done, and fungal culture also can be done. Usually, coming to the treatment part, superficial fungal infections, especially the mild ones, we treat it with topical antifungals, maybe with a oral antihistamine tablet. Whereas in severe cases, we may start oral fluconazole like 150 mg or 300 mg per week for 4 to 6 weeks, or maybe according to the severity, we can start with terbinafine 250 mg once a day for around 10 days to 2 weeks, or oral itraconazole 100 mg twice daily for 2 weeks, or 200 mg twice daily for 2 weeks. Whereas in case of nail infections, usually we give pulse doses like monthly once, 200 mg once daily for 1 week, maybe 3 to 4 months we give that. Along with these topical antifungals in case of nails, nail lacquers are there. That's it. And tell patients to keep the areas dry, since fungus grows more in wet areas, and take less oily, less spicy food, and take care of your clothing as well. Like soft cotton cloth will help you to prevent sweating as well as fungal infections. Coming to the second part of your question, why it is so recurrent nowadays? One thing I should say is, maybe these organisms are getting resistant to the drugs. It is very true that last 2 years or so, I have seen a lot of recurrences in my patients, and also infections are not reducing with lower antifungals like fluconazole or topical antifungals. I remember 2 years or 3 years back, we used to start with fluconazole, but nowadays I start most of the patients with either terbinafine or itraconazole.